How are things going where breast cancer is concerned on the island?
If there is a certain amount of time, you have to wait until you do the next check.
Let's say when they go, they finish the test, everything. How long does it take to get like results?
We have this saying, no news is good news. But we also have some persons when they get it, they are so scared you wouldn't imagine. So scared and overwhelmed, the weight, that sometimes they would come and say, Shanna, could you just read it off for me, or could you tell me what it says?
What's going on, everybody? Back again with another episode of The Talk. As you know, we're in Breast Cancer Awareness Month. So all of the episodes for the month of October are going to be surrounded around breast cancer awareness. Today, we have with us Miss Shanna Mercera-Gibbs. She is a prevention worker, if I'm not mistaken, correct?
Correct.
And first thing I'd like to ask you is, how are you doing?
I'm doing okay, thank you.
How are things going where breast cancer is concerned on the island?
Well, so far so good. Hopefully on Wednesday, that's tomorrow, the 22nd of the month, we're going to be having a breast check for those that cannot take part in our breast screening program. So we're having a breast check for the younger ones that would like to take part. So we have a good bit sign up. And for me, the entire month have been going well so far.
When you say a breast check because they can't take part in it, is this a particular age you have to be in order to do a real mammogram?
Yes, to be able to take part in the breast screening program, we take the age group between 50 to 75. And for the breast check, we mostly take from 30 and then up to to 49. And I'm not going to lie to you, there are some persons that actually they just want a check even though they might be 60, 65, it doesn't matter. They just ask for it, and we are there at the Preventive Clinic to offer that services.
Okay.
Very good. I was going to ask that because I understood that under certain I've heard in the past that if you're past a certain age, then it's not really like you're really cared for. Yeah,
it's not that you're not cared for, but then say for instance, certain things would not develop. You wouldn't see that like after. I shouldn't say not develop either, but it's more in the sense of we chose the 75 to be able to give the persons the opportunity to be able to partake, to be able to participate. In the program. If it's a lot more older, then it's not we don't care, but then they can take part in the check.
Not so much necessary, but it's a choice.
No, yes, and it's just more in the sense that you want to catch them at the 75 before they reach 76 that they can't take part. Mm-hmm. So we give them that opportunity to go and get checked, but not that it cannot be developed anytime. Yeah. Okay.
You mentioned a different age group, 50 to
75.
From 50 to 75 for the mammogram, and 30, and the age is 30 to 50 and up.
Yeah.
For the check, what is the difference between the both of them?
The check is more a physical check, and this is one of the things that we always try to promote, and we encourage our women to do this. Or you can do breast self exams. So it's about you checking, physically touching the inner circular motion, the breast, and making sure that you're not feeling any lumps, you're not feeling any changes in the skin. A lot of women just ask, when you say changes, what kind of changes? Do you know the skin of an orange? A lot of women, when it reaches that far, the skin texture change into the skin of the texture of an orange skin. Yes. And we also ask them to check all in the armpits, to try checking all there for the lymph nodes that would be there as well. So we would always encourage them to do the breast check themselves at home. Some are not so comfortable or they don't really understand what they are looking for. So then we would ask, give them the opportunity that they can come by our office. We would register them, and then once they're registered, they can be take the check. Now, the breast screening is when you go, we send them to St. Maarten, we do an intake with them, and we send them to St. Maarten to do a mammogram. And during that, then it's done in the machine. And in a machine, a lot of persons sometimes does be scared to do it. So during the intake, that's the opportunity where you can more sit down, have a one-on-one with them, find out if they had any tests done already, when was the last year they did it, if they had any operations on the breast, what kind of operations it is, what year was it done, do you have any implants, do you have any, there's so much information that you can gather from them. Yeah, it's very important to know before you go and do that, and also to know if they were ever diagnosed with cancer of the breast, because sometimes it's not all the time that they take off the breast completely. Mm-hmm. So then it's very important that you know all of these, and before you send them, then you cause more harm than good. So those are the things that we do during the intake, and then persons are more likely to sit down, they ask their questions, they are more relaxed afterwards, and then more willing to go and take. So I always just tell them, don't just say no, come and ask. And if you're still not comfortable with doing it, that's okay. Then we would schedule a breast check for person. So that is a difference. For the physical, you use the hands to physically check the breast of the lady. And with the mammogram, you have to go to St. Maarten and go in the machine to check.
Okay. When you mentioned about the type of skin, is it a part of the body by the breast area, or it can be anywhere on the skin that the orange?
Well, for most, we are dealing now with the breast. That's one of the main things that I know for sure in some of the trainings that I did. Mm-hmm. Most of them, they always ask you to check for check the skin, the texture of the skin and all that. But most of the time, that's when it's very far gone as well.
On the breast?
On the breast.
Okay.
And you're asking about other places as well. Anywhere on the skin that you may get, it may not turn out like the orange skin, but it's going to change. The color will change, the feeling may change, and you would feel something, but a lot of it have to be in the skin area, on the upper layer. But now if it's on the inside of the body, you really wouldn't be able to check, then you would have to go. Mm-hmm. You really have to go to a doctor, but we are more focusing right now on the breast, and we are doing also the cervical cancer screening as well.
So you would say someone who may be finding out or trying to see, doing a self-check, they should always just look for a lump. It doesn't come with any other symptoms?
It got other things. It's not just a lump. It could be that they're having pain. They can be having discharge as well. And you wouldn't imagine some people, women would be thinking, oh, I just see a little bit of clear fluid. What is it? Is it that I have breast cancer? No, it's not all the time. You have to panic like that. I always would tell them, you start to see something come. Yeah. Don't wait too long, because we do have situations where persons wait too long, way too long, and then when they come, they are way beyond us. We have to send them directly to the hospital. So we always will encourage them to come early. You got the check, just come and get a check if you are too afraid to go and do the mammogram. Besides that, also
I think you answered it.
I did?
Yeah.
Okay.
When it comes to the fluid from the breast, those with the leak, what color do you look forward to? Look at. Can it be like a breast milk?
Exactly.
Blood,
that's what I was getting to. It could be all kind of different colors, but if how you say trouble? I don't know how you say trouble. Could be, it's not completely clear all the time, but it could be clear as well. But I always just tell them, you never know what it is. So better you go and you ask a doctor. It could be all kind of fluid. It could be also it could be from breast milk. You got women that because they are were breastfeeding a few months before, and then a few months after they feel, and then it's coming out, or a year after. That can happen. Mm-hmm. So we don't want women to panic. It can happen. But we always just tell them, if it is quite a long time, to try their best that when you notice, like after 4 years, and then you're starting to feel you're getting lumps all the time, just go and check, because it's not all the time it is cancer. It's not all the time, and it could be too that it is something. And we do have certain women that would come and say, you know, I'm having pain, I'm having like a sticking in the breast. That's not because it is cancer.
Yeah.
You know, our bodies change a lot. Our hormones, especially we women, our hormones are sometimes all over the place, which would make it very difficult for you to kind of determine, well, hey, what this stick was about. And we do get some strange pain sometimes that would put us to really panic. That's something you just stop in the middle of what all you're doing. So a lot of the time I tell person, if it's happening quite often, then you come and you...
It can be like you do a workout or something. And
Correct.
Yeah.
Correct.
That's true.
And have you seen, for example, an increase in persons coming to do the breast check or the check that they have to go away more often, or over the years?
Yes. It have built up in 2023. We started with 47. We had 47 persons that checked, and out of the 47, we found 2 persons positive. In 2024, we had 76, quite a raise.
Yeah.
But remember, that was when we just started, so it was kind of like, you know.
Yeah.
So we had 76, and out of the 76, we find 6 positive. And then in 2025, we had 46 persons that went and did the mammogram, but we only received 32 because August and September, that was till July.
Yeah.
So August and September, we didn't get back the results as yet, and then in September, we sent persons, but then we didn't get it back. So that has happened sometimes, but it's quite, it's not quite a big challenge for us when it's come for persons going for breast screening, which is a good thing. It's a plus for us. We do our advertisements.
Yeah.
We try to get our awareness out there and all of that. But we still do encourage our persons to come more often. So it's every 2 years. So what can happen as well, that sometimes when the 2 years is not up, persons are afraid to come if they find themselves having discharges, coloring, and we keep telling them, just come. Come and let us know. Then we can refer them to the hospital. And one of the good things is on Mondays, Wednesdays, and Fridays, we always have a doctor on the floor, which is Dr. Babu.
Yeah.
And she's always there. So that's a plus for us, so that if they come and they say, well, listen, this is what I know, I just went a year ago, we just don't send them back, because you want them to wait until the 2 years. Remember, you're going into this machine, you're getting radiation and all of that. So you don't really want them to be going there all the time.
Yeah, that was
so
my question, to know, like, if there is a certain amount of time you have to wait until you do the next check.
Yes, we ask them to wait for 2 years. But when it comes to our program, if you never went in our program for us, that first time is always a first time. So you could have gone, say for instance, the hospital sent you last month, and you come by us after a month because you're having issues, and you just decide, well, hey, I want to come. For us, it's our first time, even though we know. So during the intake, when we ask those questions and you say, yes, but I went a month or 2 ago, I would always encourage a person, why don't you wait? Because you just went 2 months ago, give your body some time. So wait, at least if you want to wait till next year, but preferable 2 years before you can go and do the screening again. You got some women that would just decide, no, I really want to go and get it done, then we don't have a choice but to send them, because then it's our first time for
That was
us.
good that you mentioned the 2 organizations, because you have the government prevention clinic and you
then the
also have the hospital.
Correct.
So how do you all deal with that data? Because you say you register it as a one-time, even though they went previously.
Yes. We go on the file, because we cannot just call the hospital and ask for your information either. We will need to ask your permission. And I can't recall no time since we started that we actually had to do that. We try our best to go based on persons being truthful to us. And we know sometimes that don't happen, because what would end up happening is that they go to St. Maarten, and then St. Maarten call us, the mammogram of it would call, listen, we have this person that you were sent, they are outside, and they just came by us a few months ago, what's going on, and then we don't know
Not
because the
aware,
person told us that it's their first time going to do it,
Yeah.
or they went already, but they went years ago. But people need to be truthful when it comes to your health, because at the end of the day, you're the one that have to go through these procedures. You don't want to get more than you're supposed to. You understand? So that is one of the things that I always just try to remind them, that if they are already have been there a few months, wait the 2 years. We are glad that they would like to participate, but wait. Yeah.
So when they go to St. Maarten, how long does it take? Do they come back on the same day, or is more than one day?
Yes, they go the day and they come back the same day. So they will leave, the flight leaves around 8:30. And once the flight leaves, then they have a whole long procedure, because then they are picked up on the airport. But I would like just to reverse just a little bit before that. Before all of that can happen, remember I was speaking about the intake.
Yes.
During that intake, they would come by Miss Bernadine Punt, who's the front desk, and she would come in. You would come in by her. You would register there. Once you register, then the process would start. You would then be given a date and a time. She would give you the date and a time, and she would call you and let you know your appointment time. You show up for it. During that intake, as I say, you ask questions and all of that. But then at the same time, there's paperwork to be done, and these paperwork have to go to Bonaire. So you have it's quite, people just think, well, I'm going to just show up anytime. Oh no, I can't go today again. I got this to do, I got that to do. But then you end up all the way to the bottom of the list again. And if you're having issues, you don't want that. So the paperwork is gone. We could understand if there's sickness and all of that. Yeah. We cope with that. But then once that's done, then the day of the travel, 8:30 the flight leaves. We ask them to be on the airport for 7:30 so that everything can run smooth. They go to St. Maarten. They are picked up on the airport in St. Maarten by St. Maarten Cruise and Maritime, and then they take them directly to the hospital. That time that they are there, there's a time slot put there especially for station clients, which is so good, because then they don't have no rush. You don't have anything coming between unless it's an emergency. So that works out very good for us, so we can get them out of there. A lot of persons that we asking to, but can't they just go and get something else to eat, because food is provided. They don't have to pay departure tax. They don't have to pay for food.
That's great.
So it's offered. If they don't want, they can refuse. It's okay. And then they go and get something to eat. One of the things that we also include, we just ask them if they are allergic to anything, so that the St. Maarten Medical Center don't provide that for them, because we don't want anyone going over getting sick either.
Exactly.
Okay.
So that's one of the things that we pay very close attention to as well. And eventually at 2:00, they are picked up again at the hospital, and then they are dropped back to the airport. So it goes quite quick, and by after 3, 4 o'clock, they're back in station already.
I know some of them maybe wish they can stay an extra day.
Yes. But it's very, I find it is very rushing as well. And I do have to say that I know it have some persons don't mind. I the type when I go over and I'm ready to come home, I'm ready to come home.
Yeah.
But we have to keep in mind as well that everyone is not the same. And the rush of just being, sometimes they are finishing late as well. Sometimes they didn't get the opportunity to think, and they got to sit down and wait. Yeah. That's one of our main issues that I have been trying for quite a bit. I remember in one meeting, me and Dr. Babu was discussing the same thing, and that's one of the issues. I have a problem with waiting too long. Mm-hmm. Yeah. I don't have so much patience, and then it's not even that you have the world of things to talk about. So you're sitting there with persons that you already know, and you're talking, and so, but then after a while, an hour, 2 hours, 3 hours, that's way too long. Just to wait, So we are trying to work on that as well. And also, sometimes I remember before they would complain, that the food is coming, it's cold. So that is one of the things that they are working on. It's a small little things, but that makes a lot of difference.
To really how you say, satisfy everyone.
Yeah, you can.
Because you try your best that you have food, and the timing with food being cold and all of those things are.
And everything don't happen as planned. It never does always go as planned. It's happening, everything is happening. I wanted to ask you, let's say when they go, they finish the test, everything, how long does it take to get like results and things like that?
The results are after 2 weeks. We try our best to keep it under that, and so far it have been working good. One of the things is that we would like for persons to come and pick their results up. And you know, we have this saying, no news is good news.
Yes,
so as long as we
yes.
don't call and
Yeah.
ask them, well, listen. So one of the things that we have done is we put in place that when they are there, when the results have come, that we give them a call. So they will get a call from Ms. Bernadine Pont, and she would explain to them, well, hey, your test is here, your results, is here. You can pass by the office to pick it up. Now we got some persons don't want to come and pick it up. They prefer it by mail, so we send it to them by email. But we also have some persons, when they get it, they are so scared, you wouldn't imagine. So scared and overwhelmed, the weight, that sometimes they would come and say, Shanna, could you just read it off for me, or could you tell me what it says and all that? And we are very much open for
flexible for that.
Yeah. I know how it could be.
How do you deal with that yourself? Because not every time is good news.
Not every time is good news. When it's that is true. When it's a positive result, what we do is all test results come back to me. All come back to me. And when it reach and I realize there's a positive between, it is printed, put in an envelope, and rests on Dr. Babu's desk. Dr. Babu now have to give those clients a call to bring them in. They have 2 weeks that they have to make sure that we do the referral and the follow-up. So everything need to at least be in place for that right away. So then she would call them, she would have a talk with them, and, you know, getting bad news is not a good thing for persons. But then she knows how to, you know, talk to them and get them to understand what is really going on and why they have to be referred to the hospital. After that, then the follow-ups would start, and if they need to go to Curacao, we actually deal with Clinic. So that's where you have like everything there.
What's the name of it again?
The Mammo Clinic, we have that in clinic in Curacao, and they also does deal with Aruba as well. But the one, hopefully, because I didn't get the opportunity yet to go and see it for myself, but hopefully that would happen. And we refer our patients there, Curacao or Aruba, maybe, so they can get their continued care that they need to get.
Wow.
And then you're in that process, because then you say they get referred to the hospital. Are you guys still involved in that process, or then it just takes over?
Good question.
No, in that sense, as soon as the doctor take it over and they are referred, then we are done. Okay. We are done with that client. It did have, I think it was once or twice, that a client came back. And they came back because they just wanted to talk. Yeah. And I'm very open for that. So they would come in, and I have this kind of open door policy. So my door always open, and if people could just walk in by me. So it makes me, I don't chase, no, I don't like to tell nobody no, because you don't know at that time what's the reason, what they're going through. So then you just sit and you talk with them. If I realize that, hey, this situation is way beyond me and I can't really do much to help, and this person really, really need help, then I will ask Dr. Babu to get it well with the okay from the client and ask her to get them, you know, the extra help that they would need. But so far, nice. I never, you know, had to go beyond that as yet. But I do see that persons that with positive result, it is something that is needed on our island very much, where you have persons that they can speak with, because at the end of the day, even though you might have all the family members around to support you and all the children to support you, at the end of the day, you're alone. Mm-hmm. You know, you are. You
feel alone. Different. You feel
it's
isolated.
It's a total different feeling.
Yeah.
You know, so I can't say I know what they go through, but I can understand.
Can imagine.
You know, just being alone in a situation like that. So you do need someone that you can reach out to, that you can cry with, and just pour your heart out and know that it is just left right there by the time you go through the door. So that is something that we really need.
That is indeed a good thing. Yeah, the mental aspect of it. Yes, you're going through with it physically, but
I know one time I did ask if someone is having some issues, and I think I did just in a meeting, I just asked about them going, referring them to mental health because they are there, so even that for to start off, but they can offer the help that we cannot offer at the clinic. We need to work together on certain things because at the end of the day, we want our clients to feel for a situation, you want them to feel a lot better with themselves. You want their self-esteem to be as high as possible as they could. So you want to actually them offer what all they can get to them.
Yeah, because I can imagine, I agree. I can imagine, let's say someone went through the procedure, they got, unfortunately, breast cancer, then they got cured, and now they find it so difficult to live a normal life because they always have those flashbacks or, hey, what if it can happen then? It can happen, not truly living in the moment.
Correct.
So that's where, I like how you say with mental health can come in, to talk to them, to maybe change the way, because that's also trauma.
Correct.
As well.
Correct. But over the years of working so long, I've working since 2003, working for government. I was first the AIDS coordinator.
Okay.
And now being a prevention worker. And over the years, you realize that, you have grown, you have learned so much, and you thought you know everything, and you're still learning every day. And one of the things that I have learned in the past couple of years is that you can't do it all yourself.
Yeah.
And you need to be able to reach out to other organizations in order to help your people. And I always just tell them, I find that our island is lacking so many things, but we come a far way from where we were.
Yeah.
We reach so far the amount of things that we can offer our people now, that our community, that it's so overwhelming to see where we are today. So I am open to learning more and working with other organizations for the betterment of the clients as well.
Maybe it's unknown to me because I know they also have the referral that you can go to a doctor and request mental health.
Correct.
So I'm not sure if maybe it goes that way, but it have to be up to the individual to do that.
Especially if you are seeing yourself heading down a road that, just reach out to the doctors. And again, as we say, we have the prevention clinic, and if you feel, as much as we deal with cancers, NCDs, non-communicable diseases, and with our main focus on diabetes, hypertension, and obesity, I still find that if you just reach out to us, we're supposed to be able to tell you, hey, this is the direction you have to go in. This is the department that you have to go to. And again, if we work together like that, I think it helps not only the client, but it also helps us to be able to create that bond, that teamwork, in order to be able to give all the best care possible to our clients. So.
As you know, we sat down with different persons that talked about their breast cancer and what they went through. And one thing we had is that when you, for example, if you're encouraging persons to sign up and come to do their check, you're very persistent as to, hey, I want you to come and check. And what makes you so persistent with people to make them to, not make them, but encourage them to come and check?
I really don't know where that comes. I think that's just maybe who I am. But I know in a lot of different cases, sometimes it is just something that is telling you, that if I got to explain you that, I think I would be going wrong. Because, listen, sometimes that person don't want to. And as I say, I respect everybody's point of view. Sometimes they will come in and say, Shanna, because of X, Y, Z, I don't want to. I am very scared of it. And it is okay to be scared. But better that you know than you don't know. I would not like to know. I had a client in front of me that refused, and then somewhere along the line, maybe just a few months after to a year, then they are positive. I don't think I could deal with that. So I don't be on them and breathe down their neck, but there are a few of them I would be like, just go do the test. Just come do the test. You could come. Sometimes you're calling. Listen, we got so-and-so. You ready yet?
Yeah.
it's sometimes some persons need that extra push, and it have some persons that it's you encourage them, you explain them, you go down to a team, then when you're done, you leave them.
Yeah.
It have certain persons like that, but
Comes
it is
over to pressuring.
Yes, so you don't want to pressure them where in the long run they don't want to.
Yeah.
So you got to. I think it's just some part of me. You just know. You just know when it's the right time to push and when it's the time to just, I'll leave it. And I did have a client where I just was like, come, why not? And they explained, and I left them. And then a few months after, I called them and said, you had a few months ago, you said you didn't want to. You still not ready? And they said no. And I was like, okay. And out of the blue, a day I called, and we were just talking. Nothing about, just talking.
Yeah.
And then they said, Shanna, you got to put me down for that breast thing. And I was like, which breast thing? Because we were talking about something totally, so they threw me off.
Yeah.
And then they was like, yeah, for that breast thing, I don't really want to take it, but I think I need to go and do it, And I was like, right away, like, dude, you need to put down this, put them, no, the next flight it got out, they got to be on, because, it happens. And then it also have those that you just let them be like that, and you encourage them to do the breast check instead. But I know there was into a situation where the person didn't want, and eventually they did, and they did find out afterward that they were positive.
Can you imagine you save lives there?
It was. But for me, when I found out, I then needed mental health afterward, because when I say mental health, but I needed, because I cried. I was like, Lord, look what now I put this person to deal with, because we do have people that don't want to know either. And I respect that as well. If they turn and say, Shanna, if I have breast cancer, I don't want to know. So I respect that, and I always just, it's okay, then we would leave you to do the breast check. Would you like to do the breast check? No, I don't want to do that neither, because they could find something. So you leave that person be. But I know with that person, I cried. I cried for days. It had me so.
I can imagine.
Yeah, I was like, Lord, now this person gonna deal with it. But the person that they were, after they came and said, Shanna, you don't worry. I was like calling them, you okay? You doing okay? You need somebody to talk, because I said, look what I going to do.
Because you will be constantly, it took Shanna for me to go and.
But eventually said, Shanna, I go. I'm okay with it, and I'm getting the help, and the referral went okay, and so it was a, you can't save the whole world, but for me, if I can save one or two persons, it makes me feel good. But I had to learn how to, accept that's what it is, and then how to deal with it for myself and also for the client. So that was a learning process for me as well. So.
Thank you for sharing that personal experience.
See, when you said you talked about a person that eventually came around and wanted to do the test. Is it that, because you say you have to be on the next flight out, is it that there are multiple flights throughout the year, or is it just mainly in October that the persons get to go away? We
have, it is not only in October, we have flights every month. We have, January, I shouldn't say every month, forgive me for that. In January, we don't do any flights. The reason for that is we are just starting off the year, and we are trying our best to set up our programs as well. But it's not only the breast cancer things that we are doing. We're doing multiple things within the office. So a lot of persons are saying, it's only the breast thing that they're doing. No, we're doing multiple things. So we don't do none in January. July, we do not have any flights, because then everyone is going on vacation and all of that. And then that makes it difficult to get persons to full a flight, because a full flight is 8 persons. So we try our best to make sure that the flights are filled. And in December, last year we didn't have it, but the year before we had a one in December. But most of the time we try to avoid again. And so it's a certain amount of times per year that we need to have flights. Now, say for instance, if we are full to the rim, that when I say full, that we have so many persons, but not enough flight, I can always request a flight in. So then I know I have enough for another flight, then I would request a flight. So that was given that possibility a few months ago. So I was quite glad for that. especially seeing that December right now, we don't have any flight, but I am seeing where we are going to have to put in a flight maybe for December. So just for persons to know, it's going quite okay.
I like that flexibility.
Yeah. I was really happy for it because we can also cancel. So for instance, in August we had 2 flights, but one of the flights we had to cancel. So to make up for the months that we don't have a flight, we had to put 2 flights, which is okay. But then I end up canceling because in August persons were not back as yet. So those that was on the list, this one is away, that one is away. So you're trying to push in another person, and they are away as well. You know, so I was like, no, we're going to cancel that flight and we'll put in another flight elsewhere. And then, you know, it's very flexible.
Yeah.
And I'm glad for that. And they give me the opportunity for us at the public health prevention clinic to make that choice whether we're going to have a flight or not.
Okay.
So we try every month that I try to make sure that there's a flight in place.
Okay. That's good.
And I see you mentioned based on, like, we are talking about the statistics as to how much people came, how much people signed up, and you said that the amount that you mentioned was based on half of the year, because is it that they just count, okay, the 6 months for that part, then the 6 months for the rest of the year, or how does it count?
What happened every year, they just bring out like a
booklet
with information and all of that. What happened was we had a meeting, and one of them had to give a presentation, so they shared that information. And that's when I remembered in September when we had a month of the Health and Sports Expo. My goodness. I had to give a presentation, and I was all over the place looking for these statistics because I needed it. And then is when they turned and said, well, okay, we're going to share July, but remember, until July, because we don't have any more information. So that is where the 46 persons for the year went, and only 32 results we get back. I think I'm saying it right, 32 results, and then out of the 32, 1 was positive. Okay. So we still got the rest of the year. So eventually they'll give us 1 for the entire year.
Before we close off the interview itself, is there a specific message you would like to leave for the community?
I would encourage our community, especially our women in the community, to come out and get tested. You don't have to be afraid. We respect your choices that you make. So if you don't want to, there's always a check that can be done. And if you don't want to do the breast check, feel free that you can come in and you can talk as well. Just talk about it. You can share also your views, because I don't know everything. And for me, every day is a learning process for me. And I'm always open to hear. And I think you can share your suggestions, your opinions that you have, that we can be able to better ourselves. We are not perfect at a prevention clinic, but we want to reach out to our people in the best way possible so we can offer the best care that we can offer. So if you have other suggestions, may it be, how to reach them in other ways that we can reach them, or, just come on down to our clinic and share your views. One of the things that was just added is that after they are back and they come to pick up their test, we just ask them to fill out a survey. Mm-hmm. And persons will try to make it as nice as possible. You don't have to do that. When you come, if you feel that maybe you didn't go on a trip, but you feel you want to, fill it out. Give certain things that we can better ourselves. I may not be the most...
Some suggestions.
Yeah, but your opinions help me to better myself so that I, in turn, can help someone else. So be open, share, but be willing to take the test. And one more thing, it's not only women that can have breast cancer, because men can get it as well. So I need to be able to say that men, if you too need to feel comfortable to feel, and check yourself so that you are able to go to the doctor to say, well, somewhere in the area, I felt something. Could you check it for me? So that's one of the things I want to share.
That is an interesting one. I wasn't expecting that. That's a fun fact.
Yeah.
Like,
I didn't know that at all.
Didn't know.
Yeah. And they just feel all the time, but we only dealing for women. No, men can get it as well.
Exactly.
You know, it's just not as common because of the things that women go
In
through.
Stacia?
Well, in Stacia, I never heard of
Came
anyone
across,
with
yeah.
it.
I guess it's
a
rare.
male with it before. Never. I don't know if they have, and I never even once asked Dr. Babu, you know, is there a male? Never. But I just need them to know that our men, males, they can get it as well. So when you're taking your shower, that's the best time to do it. Check. All right, Mr. Pond, check.
I was looking cross, but he had
Yeah, because you two, the both of us heard and watch you.
Shanna, I would like to thank you so much for coming on the talk.
Oh, and also I would like to thank the talk for collaborating with the Public Health Prevention Clinic in the month of October when it comes to breast cancer. And I really do appreciate you all and what you do. Thank you.
Thank you so much.
Thank you. Like I say on Jackie the Imagery, the talk, capture the moment, watch it forever. See you guys in the next episode. Bless.